Tobradex St Suspension, drops, final dose form, is used to treat or prevent eye infections. It contains two drugs, Tobramycin and Dexamethasone. Tobramycin stops the growth of bacteria, while dexamethasone reduces swelling. This medication only treats bacterial eye infections and should not be used for other types of eye infections. It's important to use this medication as prescribed to avoid decreased effectiveness. The recommended dosage and timing should be followed as directed by your healthcare provider. When using Tobradex St Suspension drops, it's important to follow these steps for proper application. First, wash your hands to avoid contamination, and do not touch the dropper tip or let it touch your eye or any other surface. Shake the bottle well before each dose. Do not wear contact lenses while using this medicine, and sterilize contact lenses according to the manufacturer's directions. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Look downward, gently close your eyes for 1 to 2 minutes, and apply gentle pressure at the corner of your eye to prevent the medication from draining out. Repeat these steps for the other eye if directed, and if your dose is for more than one drop. Your dosage is based on your medical condition and response to therapy. Do not rinse the dropper and replace the dropper cap after each use. If using another kind of eye medication, wait at least 5 to 10 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. Use Tobradex St Suspension regularly at the same times each day to get the most benefit from it. Continue to use this medication for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, be sure to contact your doctor. Some common side effects of Tobradex St Suspension drops may include temporary blurred vision, eye redness, eye discomfort, and eyelid itching/swelling. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. Using this medication for prolonged or repeated periods may lead to a new fungal eye infection and increase the risk for other eye problems, such as glaucoma and cataracts. It's important to use this medication only as prescribed and to notify your doctor if you experience any new or worsening eye symptoms, vision changes, or eye pain. While very serious allergic reactions to this drug are rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Tobradex St Suspension drops, make sure to inform your doctor or pharmacist if you are allergic to tobramycin, dexamethasone, or other aminoglycoside antibiotics. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss any allergies with your pharmacist. Also, let your doctor or pharmacist know about your medical history, especially if you have other eye problems such as glaucoma. After using Tobradex, your vision may be temporarily blurred or unstable. It's important not to drive or use machinery until your vision clears up. If you are pregnant, only use this medication if it is clearly needed and after discussing the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. In terms of daily usage, use Tobradex as directed by your doctor. The usual dosage is 1 to 2 drops in the affected eyes every 4 to 6 hours. The best time to take this medication may vary, so it's important to follow your doctor's instructions. Remember that Tobradex St Suspension drops, final dose form, may interact with other medications, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. This will help to ensure that you are using Tobradex St Suspension drops, final dose form, safely and effectively. Always consult your doctor before starting, stopping, or or changing the dosage of any medicines. If this medicine is accidentally swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's essential to keep this medication out of reach of children to avoid accidental ingestion. Do not share this medication with others. This medication has been prescribed for your current condition only. Throw away the unused medication after treatment is completed. Do not use it later for another infection unless your doctor tells you to. If you are using this medication for more than 10 days, lab and/or medical tests, such as eye exams, should be done while you are using this medication. Keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't take a double dose to make up for the missed one. When storing Tobradex St Suspension drops, make sure to keep the bottle upright at room temperature and away from light. Some brands may also be stored in the refrigerator, so it's important to check the product package for specific instructions. If you have any questions about how to store the product, don't hesitate to ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When it comes to properly discarding Tobradex, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to discard the product when it is expired or no longer needed. For more information on how to properly dispose of Tobradex, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.